Welcome to the Digital Healthcare Experience, brought to you by Taylor Healthcare. Subscribe now and stay on the forefront of the digital healthcare revolution.
Hello and welcome to the Digital Healthcare Experience podcast presented by Taylor Healthcare. I'm your host, Chris Civitaris, and today I'm joined by Randy Subramany, Director of Supply Chain Management at New York Presbyterian. Over the last 8 years in this role, Randy has been managing a team of 135 supply chain professionals that strategically and operationally are responsible for the ordering, distribution, and receiving of over 15,000 unique disposable medical supplies used across the inpatient, outpatient, and operating room settings. His career started on the strategic sourcing team, where he was responsible for overall business relationship management for the thousands of vendors that provide professional services to NYP. During the pandemic, Randy led efforts to ensure supply chain readiness and respiratory safety. And in 2023, he authored a book entitled Supply Chain Management, Origins, Evolutions, and Transformations, illustrating his passion for the industry. Welcome to the podcast, Randy. It's a pleasure to have you on.
Chris, excited to be here today. Thank you for having me.
It's our great pleasure. And where we usually like to start with these discussions is just having our guests sort of give a little background of their journey from a career perspective in terms of how they got to where they are. So can you kick us off by telling us a little bit about how you got to being Director of Supply Chain at NYP? And supply chain is a really interesting area to go into. One of the things that always comes to my mind, talking to folks is, was that intentional, right? Was that your calling? What sort of led you to supply chain and how'd you get here?
Yeah, Chris. So I wish I could tell you that I had childhood aspirations of becoming a supply chain leader or guru, but that would be false. Candidly, not until 10 years ago did I really hear the term supply chain management and really give it some serious thought. So let's rewind. 10 years ago, the Affordable Care Act was being passed, and I was pursuing a master's in public health. And I knew that I always wanted to work in a hospital for a variety of different reasons, but it wouldn't be in the medical space or in the patient care space. It would be more in a business or a support services lens. And with the passage of the Affordable Care Act, long story short, a naive grad student, I thought to myself, hospitals are going to be challenged with anything new. And how could I help to make an impact? And I stumbled onto two opportunities, one on the revenue cycle management side, which is helping hospitals, in essence, maintain their revenues and increase their revenues through reimbursements. And the secondary would be on the supply chain management side, just based on the simple logic of hospitals need to reduce their expenses. What do hospitals spend money on? Number one is labor. Okay, no one wants to have harsh conversations about reducing labor, especially not 10 years ago. And the second was around this bucket of supplies. And I thought, wow, hospitals spend billions of dollars a year on supplies. And that just seems right. Again, naive, young graduate student making some assumptions about how the world actually works. But landed a consulting opportunity that gave me the exposure to this complex, vast world of supply chain management. And then from there, Chris, time on the data side, time on what we term the value analysis side, transitioning into the contracting side that you hit on, and now into the real bread and butter operations side. It's been extremely fulfilling. And I think the journey is just really centered around doing my part in this big ecosystem that I'm sure we'll get into to ensure that patients or human beings in the end are well cared for. So to your point, extremely passionate. It's a world that is complex. It's a world that's, especially on the healthcare side, becoming more and more advanced. But, and you referenced the book I authored, and, hopefully in 10 to 20 years from now, we'll have supply chain experts like myself on many more forums like this, just discussing the critical role that we play to just keep patients safe and to ensure our clinicians are ready to care for those patients. So, Chris, in a nutshell, that's my journey, and happy to talk about where I think the journey of supply chain will be in the coming years.
Yeah, absolutely. And I mean, it's great to see that supply chain is starting to get even more recognition in terms of the value that it brings to patient care. I mean, long gone are the days where, supply chain was, in the basement and, part of sort of that, yes, cost savings, operation, all that. But it feels like in the last few years, especially, in the last decade, as you describe, so much more sort of, I'll say, integration of supply chain into sort of the macro, callings of patient care, of how we leverage technology, of where all of those intersections are. So I think it's such an interesting area of study and of practice to be in today, for sure.
Yeah, Chris, I would agree. And I think maybe in the more immediate term, we think back to the COVID-19 pandemic at the height. And I think supply chain management became that buzzword you would see across newspaper headlines, or folks ran out of toilet paper. And it's because of the supply chain. I think its importance, and also the opportunities to drive improvements. And I know we'll dive into technology in a moment, but centered around people, processes, and tools, there's vast opportunity to continue to advance this field. And I'm hopeful that the talent in the field continues to grow at the pace that's needed to really support patients and to support the world, candidly.
That's great. Let's start talking about that technology, because we are, maybe in our lifetimes, at the precipice of what is, the absolute breakneck, change and pace of technology sort of shifting again. You and I sort of came up in the world when the internet was a thing, and then when the smartphone was a thing, and now obviously, artificial intelligence is sort of next. So we've explored on this podcast artificial intelligence through a number of lenses. But we haven't quite looked at it yet through the lens of supply chain and what it means to folks like you in this domain. So I'm really curious. Let's start there.
Sure.
The artificial intelligence, from a supply chain perspective, as a supply chain leader, and somebody who has looked at this through the lens of practice, academia, research, what is happening in this space with AI, and how are you feeling about it?
Yeah, so Chris, I would say, and I'm going to keep my comments narrowed towards the hospital space and the patient care world. I'm sure if you had folks here from Amazon, Walmart, all the big box retailers, they would have a light years of advanced conversation with you as to where they are and how they're thinking about it. Healthcare naturally lags, and I'll summarize my stance as an optimist, but maybe with a slight degree of caution. And why I say that, and how I think about AI in this space, but why I say that first is because, as I'm sure you know, hospitals, or to make clear to the listeners, from a profit standpoint, relatively slim margins. Most hospitals, maybe carving out the for-profits, operate at less than a 7% profit margins, which pales in comparison to big tech companies that have significantly higher 5 to 10 times profit margins. Why that's important is because at a CFO or senior level, when you have a profit, again, it's invested back into the business at a not-for-profit level, you have to make tough decisions. Are we making investments in the artificial intelligence space for supply chain? Are we building a new cancer center? There's so many competing interests, and those are just two I've outlined, where there could be dozens at a time that senior leaders have to make. But what I will say now is just maybe pivoting is, in a way, we have no choice but to embrace artificial intelligence in healthcare and in the supply chain space. And from my standpoint as a leader, I think of it as really two buckets of AI per se. The first, which is present currently, not optimized, but present currently in hospitals, is maybe this traditional model of AI. This model of AI where built into ERP systems, built into separate software, you utilize artificial intelligence to analyze and to automate relatively mundane tasks. So what do I mean by that? Let's say from the supply chain lens, we have an accounts payable department that's responsible for paying our vendors on time. And of course, that's of the utmost of importance, because without our vendor partners, again, this ecosystem, we can't do what we do or provide the supplies needed for patient care. But utilizing AI, for example, to read invoices, upload information into an ERP solution, and then to just really click a button, or to train an artificial intelligence to click a button so a check is cut and mailed to a vendor, removing that human element from a truly mundane task and allowing that person to focus more on other value add areas. So accounts payable is a traditional model. Others, maybe from a true like supply chain operational leader, is around like forecasting and in demand predictions. One thing in healthcare we have a lot of, and we'll get into more of it, is data. Are we great at analyzing and interpreting data? Oftentimes we're not, but we're getting better, at least from the traditional sense of I have all these vendors, I purchased all of these catheters, all of these gloves, whatever supply it may be. AI helped me forecast what we may need to keep in stockpile for the next pandemic or something along those lines. And I think, Chris, that's where now evolving, I dare to say, from this automation and analysis perspective to the second bucket, this generative AGI, as we're hearing, this generative artificial intelligence, where the focus is shifting more towards synthetic data or scenario data, really from a supply chain lens. And why that's important, Chris, is what I've just described, let's say with forecasting for 10 core supplies that are needed. We rely on sometimes consumption data or sometimes historical purchase data to drive what we buy. But imagine a world where we take that data, we utilize artificial intelligence to not only predict what we need or help us prescribe what to purchase, but we're then able to say, you know what? Let's pretend there's a constraint with a degree of inputs. Or let's pretend, for example, we're unable to purchase from location XYZ. Help us craft a plan or generate a plan to cater to this scenario. So in the supply chain world, especially on the pharma side, you hear this term like digital twin, basically creating a replica of your supply chain and then creating different scenarios to predict the future or to help inform how we manage inventory, how we optimize our routes to move products from fulfillment center A to destination B, all as of significant importance. And then, Chris, not to belabor the point, but from like a generative perspective, again, slightly away from the operational lens, but more to the procurement side, thinking more through like risk management, we can use AGI to drive or help us create risk analyses based on inputs of different vendors, whether it's geographic. Again, geography is a big footprint. How much a vendor is investing in their R&D, all just so many different inputs and too much to get into onto this call. But I dare to say the generative aspect is going to help operationally, which is my lens, and I'm happy I will talk more about. But I do want to recognize there's that front end lens from the procurement, from the strategic sourcing side, that generative AI will help to mitigate risk, but also to help us make more informed decisions at a supplier, at a raw materials level. So again, Chris, I'll summarize it. Cautious optimist, thinking of artificial intelligence from the traditional lens, but slowly, I say slowly because healthcare is just a little slow, tad bit, but slowly evolving more to embracing this generative approach.
Yeah, that makes just a ton of sense. And, really, it sounds like, Randy, what you're describing, I mean, supply chain is being challenged to rethink the way that they're delivering value to their organizations. So it's certainly that the financial end of supply chain considerations are always going to be there. But I wonder how the integration of technology, particularly AI, is sort of molding, shifting, influencing the way that you look at the benefits that supply chain can bring to healthcare organizations. So what does that look like to you today and kind of as we evolve into the future?
Yeah. So Chris, what I will say, and again, I'll keep my slightly narrowed lens on as a healthcare leader and in supply chain, and I'll add on New York City. So New York Presbyterian, urban hospital consisting of 10 or 10 hospitals within our system. And many different other facilities supporting patient care. But geography plays a big part of how we're thinking about the use of artificial intelligence in supply chain. So I'm currently on the island of Manhattan, and I reference Manhattan as an island because, one, our hospital has so many space constraints. It's not as though we have the accessibility, and I'll get to the benefits in a moment, but to illustrate the point, it's not as though we have the accessibility of having a warehouse a mile or two down the road that many of our suburban and rural partners can benefit from. So we have to think differently. And when I say think differently with artificial intelligence and technology in general, I think the first is utilizing AI to help us, and I reference it slightly on the generative lens, respond faster to supply chain disruptions. And I say that as we shift more towards this environment, you'll hear terms like the Internet of Things, sensor data, knowing kind of in real time where things are. Walmart does this to a T of perfection. In healthcare, we're aspiring to get there where we know where our shipments are not just based on a tracking number, and you hope to God that on the right column of that FedEx webpage it says out for delivery or delivered, but it's knowing, for example, where our supplies are with like the use of satellites, or actually to a pinpoint of, I think of the analogy of you've booked an Uber and you know exactly where your car is. Imagine a world where you know where your supplies are. And that's one, Chris, as a leader, utilizing that technology to not just be prepared for like disaster and disaster relief, but there is a reality of a patient comes in with a trauma to a hospital. And there's a need for a specific, it could be an implant tied to their spine. It could be an implant tied to a different part of their body where, and I don't want to get into the complexities of of care for these types of trauma cases because it's extremely complicated. But let's just hypothesize that patient presents with a unique need. You don't have what you need, but you're able to track in real time in partnership with a medical device company. Oh, it's being sent from New Jersey. It'll be here in 37 minutes. Building in traffic data, building in all of the different logistics that go into play. So I think responding to disruption is one key area where I think we need to be better at from a healthcare perspective. And I know we'll get there. The second, and I'll maybe conclude on this point, because I think it will include a lot. It centers around this idea of utilizing technology to help us drive how we allocate resources. So as a supply chain leader, there's two fundamental assets per se as how I think of it. Maybe not the right term, but how I think about it. The first is around the actual goods of the supply. So again, technology, Chris, utilizing artificial intelligence to have a variety of different inputs to drive how we forecast, to drive the actual inventory we keep on site. And in urban hospitals, again, we don't have a lot of space where we're running a just-in-time inventory for the most part with buffers in certain locations and in certain areas. But demand forecasting, inventory management, again, I harp on this route optimization as one of the future things that hospitals need to get better at. And the technology is there. It's just a matter of investment, buying, and prioritization. But I'll shift slightly, Chris, now to utilizing the benefits of technology and AI for a human resources elements. So think about a world where we could measure like take like inputs like discharge data, like all of our procedure card. And I'm getting into like the weeds of healthcare, of hospitals themselves, but discharge data, procedure card data, to really drive how much we buy and what we buy of and how we stockpile. And then also to potentially drive how we staff, because there's definitely elements of variability and seasonability, if that's a word, to how we model our staffing. But we're stuck in this antiquated era. If it ain't broke, don't fix it, versus how do we optimize? So I think, Chris, and I may have been a little long-winded in getting to the answer to your question, but I think the summary is now more than ever, supply chain leaders have to think about disruptions. And I wish I could tell you like that everything has gotten better per se. It's just the new norm that supply chain leaders have to live in. And utilizing technology where in a world where there are scarce resources from a raw materials and from a human perspective to respond to disruptions, but then also to help us drive better resource allocation from a supply perspective and from a human perspective.
It's really interesting. I'm curious too. So you've mentioned a couple of times, healthcare is a little bit behind the times in terms of adoption of these technologies, and that's probably true of healthcare over its lengthy history in terms of adoption of new technologies. And you've referenced a few companies outside of healthcare that do this really well. I'm curious that from your perspective, living in one of the biggest and best healthcare organizations in the world, do you look outside of healthcare in terms of retail or hospitality or any of these other industries in terms of kind of gleaning learnings from organizations outside of hospitals, outside of healthcare that you can apply
Yeah.
to your role within the healthcare space?
Chris, the short answer to your question is yes. I think we always try to take the best practices from Amazon's and from even healthcare partners who do it well, like big distributors like Cardinal Health and so forth too. So I think fundamentally, and GHX and in this ecosystem, there are definite best practices that we try to bring in. What I will carve out or just say that healthcare, as I'm sure you know, and just to make it clear to listeners who are unfamiliar, highly regulated, highly complex, just simply because you have hands from the federal government to the state government, through the forms of like CMS, the Centers for Medicare and Medicaid Services, who reimburse hospitals. You have commercial insurers, you have lobbying groups, you have your consumers. There's so many different stakeholders that drive even to the level of influencing a supply chain, because it all kind of goes hand in hand together. That causes that lag and causes a degree of caution. But I think the right healthcare organizations, and I think New York Presbyterian is doing this well and is poised to continue to advance, have recognized that although, to your point, healthcare does move slower, it's in a way foolish and maybe irresponsible is too strong of a word, but foolish to not look outside of healthcare to see how others are treating their supply chain, or to utilize tools. And I know I'll pick on Microsoft, and they recently had their Copilot released. How tools like that, not to say I've dived into the weeds and have experimented and say that that's going to solve all supply chain issues, but how tools like that could help us be better prepared for disruptions and help us better manage our resources and how we allocate our resources. So always seeking best practices, always seeking to learn. It just sometimes healthcare gets too complex for those changes to happen at the rate that we need them to.
Yeah, it's really interesting, and I mean, you touched on some of the challenges there in that last response. I'm wondering, I mean, if you looked at sort of the playing field broadly in healthcare, from a supply chain perspective, AI, where are those challenges? I mean, we talked a little bit about the multiple stakeholders, highly regulated. Are those some of the things that make adoption of AI and other sort of advanced technologies more difficult? And is there anything else that you can think of in that space?
Yeah. So, Chris, I mean, the regulatory challenge, it's certainly one. I think three others come to mind. I think one, there still is an element of technical challenge. I do think that healthcare as hospitals, or healthcare in general, we sit on a ton of patient data, a ton of, from a supply chain perspective, like purchase data. We sit on a lot of qualitative and quantitative data. Now, I think a few things as we think about AI and technology. One is data tends to be either unstructured or not in the right format that allows for artificial intelligence to read the data, to digest it, and to really have that generative output that would yield something of value. So I think there's work to be done to get data, again, unstructured. It comes from various data sources, and it's a lot too. It's a lot of data. There's some work to be done to get us there. And there's elements with quality and data silos still existing, but I think healthcare itself is getting better, as most academic institutions on the hospital side have Epic, for example, as a vendor. But I know Epic is making advances as well. I think maybe even taking a step at a broader level, Chris, there is, and I referenced this organizational buy-in at the top of the hour, but there's still organizational challenges. I think fundamentally, there's always going to be resistance to change, because to your seasoned supply chain leader who's been in this person's role for 30 years, they may not see the value of artificial intelligence. They may operate in this world where things have worked well. Here's what we've done. We hold true to our processes and our systems, when fundamentally there are ripe opportunities. So I think there's that resistance to change from an organizational perspective. I think the second ties to this concept of integration. Again, getting data sources together into into like a singular source of truth. It's not only technically challenging, it's technically expensive. Whether it's contracting with a third party to do this, whether it's investing, opportunity costs, whether it's asking folks in IT or supply chain to invest that time to generate or to create or craft or format the data in a way that allows for all the benefits that I've referenced. So definitely some organizational challenges. And I think I'll end the fourth, or maybe the regulatory would be like another one that I referenced before. Lastly, and this one may seem a little unique, I think there's still an element of ethics that go into play with this. I think complementing this reference to resistance to change, I still think there is this viewpoint that, artificial intelligence, people have a bias towards it in the sense of like it's a human, it's some entity here ready to take away jobs or ready to become a terminator of some sort. I hate to use the analogy like that, not trying to ensue the connotations of that movie, but some sort of force that's here to cause chaotic disruption versus an enabler to complete some of these mundane routine tasks or to help us plan. I think is another layer of challenge. And I'm optimistic that as there are generational shifts in the workforce, that there'll be more of this onboarding. Again, healthy dose of optimism with caution, but there'll be this healthy dose of technology is a tool that I will use in the logic of having a mentor, like a tutor, help you with something. Technology and artificial intelligence for supply chain leaders will become this tool that can give us quick answers to help us solve either real-time issues or plan for something more strategic. So, Chris, technical challenges, organizational, regulatory, and I'll term the last as like ethical challenges.
Yeah, I think that makes a lot of sense, and I mean it's really, really interesting when you sort of look at AI through sort of the historical lens of all of those other technologies that have sort of come over the course of of healthcare's history, right? I mean, from the EHR to the smartphone to the internet and so on and so forth. It's pretty amazing to me that it seems like we always talk about those same sort of elements in healthcare, just through like a little bit of a different lens as these technologies sort of start to get introduced into the fold. So I'm optimistic too about it, Randy, simply for the fact that, healthcare has seen these big seismic shifts from a technology perspective. And I don't know about you, but I would say overwhelmingly, the seismic shifts in technology have been overwhelmingly good for patients and good for the healthcare ecosystem, even if it takes a little time to get there.
Yeah, Chris, I would fundamentally agree with that statement and the sentiment that technology is helping to move us in the right direction. And from a healthcare perspective, that can, I mean, there are complex ways to measure that, but I think simply it's ensuring ways to keep our patients safe or to ensure our clinicians are rendering safer care. And I'll also say with healthcare, there's this element of access to healthcare. We have in New York Presbyterian, world-renowned doctors providing care. Sometimes access is not so simple in terms of booking an appointment or finding the right way to book the appointment, whether it's via a phone call, via an appointment app, or whatever it may be. But I do think if measuring the 2014 to the 2024, without doubt, that technology has been a driver to create benefit in the healthcare space.
Yeah, totally agree. I guess as you look ahead, what are you seeing? What do you think will be the most significant trends and challenges? And what are we going to see in 12 months or 3 years from now in this space if you had to sort of, get your crystal ball out?
Yeah, sure. So, Chris, I'll touch on two things that are slightly repetitive to the greater themes I talked about, but then conclude with two that are newer per se. First, I think when it comes to just general trends and themes, there will continue to be, and it likely will amplify, or it'll be this movement of cooling and followed by a harsh amplification of this theme of supply chain resilience, which is basically an organization's ability to respond or resume normal operations during or after a disruption. And that's driven by, again, pandemics, natural disasters, but how a trend we'll notice, or I'm going to hypothesize that we'll notice, is more and more hospitals will begin to incorporate artificial intelligence to help maintain that resilience or that preparedness for the unpredictable. Never going to be perfect, but we'll be better prepared in the world with technology and AI than a world without. So I think this theme of enhanced supply chain resilience will continue. I think there's an added layer, and the world gets so complex with how you respond to product recalls, for example, but I think there's going to be this added layer of utilizing artificial intelligence to maintain regulatory compliance. I think when we look at, and this is not my exact area of expertise, but I have enough familiarity with it. When we look at like the FDA's Drug Supply Chain Security Act, which in essence requires manufacturers to trace and disclose every layer of where stuff or materials are coming from in their supply chain, utilizing AI and technology to track that, to report that in real time, to again remove layers of manual work that's tedious, that is important but mundane, away from people into technology, so then humans can then focus on things that require a greater degree of intelligence. So I would say, to be a little repetitive, these trends of regulatory management and resiliency management will continue in the supply chain world, especially within healthcare. What I'll conclude with is saying that I think will be new. I think there's two things. One, we're noticing more and more this push in healthcare towards, I'll term it as like personalized healthcare or like precision healthcare. So for example, like how I live that every day is we have a lot of custom implants that are built specifically for patients, whether it's a custom stent, whether it's a custom form of a knee implant geared towards a patient with a unique condition. We'll notice the use of AI to help manage that more, simply because, and I'm not saying this move to precision healthcare is aiming right now to be like the majority of the care. It's still in a narrow niche type of area in terms of like volume of care, but it requires stricter management. There's smaller lot numbers, smaller batches, different types of transactions required, different types of approvals required, where, for example, a physician goes into a portal and has to review some imagery to validate the custom implant is exactly what's needed. Layers of like, I think, human touches that may no longer be needed. And I will say, one thing I do predict is regulatory bodies will require organizations, especially in healthcare, to be able to more readily pinpoint where they're buying things from and to trace back just when there are product recalls and other disruptions. So the government and other regulatory bodies have a clear, whether it's the Joint Commission, the FDA, have a clear understanding. And Chris, I'll just conclude by saying, rightfully so, we're heading into this world of a circular economy, or an economy focused on sustainability and environmental impact, which to me, I think is the right approach. And how we adopt those practices, how we measure carbon emissions, even at a supply chain level, or how I think in the future, I think Germany has a very strict supply chain act, and I use strict as in the beneficial sense of asking asking specific businesses to report out on environmental details. And we're headed towards that direction in the United States. We're not there yet, but I think utilizing like AI, whether traditional or generative, to help us assess our footprint as a hospital, help assess the footprint of all of our suppliers, of all of their tier 1, their tier 2, their 3 suppliers, is the direction we'll head in. It's complicated. It's fast. There's so many arms and there's so many different organizations that will be represented. But to your point, Chris, I think you made the comment of, not in your words, but we've seen exponential more than linear growth with technology. And I think that trend is going to continue. And I think it's going to continue in ways that we haven't even predicted yet. But I think these 4 trends tied around resilience, regulatory readiness, precision medicine and healthcare, and then sustainability are ways that healthcare-based supply chain organizations need to think about how to use AI more moving forward.
It's really interesting. This has been just a wonderful conversation, Randy. I think this is a space that is going to just continue to accelerate in terms of the opportunities and the possibilities. To your point, there are things that we don't even know are possible yet, but will certainly illuminate, over the course of time, which is really exciting. To wrap up, is there anything else that you're working on or excited about that you want to share?
Yeah, I think Chris, to keep with the technology lens, I think we are, without being too specific at this point in time, we're thinking critically of how we partner with major manufacturers to better assess our inventory levels using AI. I think so that's one thing I think, we're very excited about it. I'm very vague with that, but more to follow. Maybe Chris, you'll invite me back in a year or two, and we can talk more about those advancements. But I do think, one thing I'm excited for to get more hands around is the use of, for example, I think think it's Cleveland Clinic who's begun this, is the use of chatbots in the world of supply chain, where, for example, like in my role, my customer in an odd sense is our clinicians. My responsibility is to ensure our team is delivering literally supplies for clinical care. And then by association, patients are our customers too as a hospital, and in a grander sense. But, imagine a world where, and again, more of the visionary cap than the material cap, where a clinician or an end user can say, or a nurse can say, hey, I've noticed we're out of this supply of this syringe on the unit. Is the product on a back order, for example? Being very general with this. And then having some intelligence respond back to them saying that, yes, currently New York Presbyterian is experiencing a back order on a 10 milliliter syringe. Please utilize the 12 milliliter syringes in your clean supply room in the interim. Expected resolution date is XYZ. That's more of a future project that, I certainly will pitch and try to build off of. But I think it's just this general, it just connects to this general trend of technology to make life better for our patients.
It's really, really wonderful. Randy, it was so great having you on. Thank you so much for joining us. And, you volunteered to come back, so we're going to hold you to that. As you continue this journey, we would really, really love to have you back on to, just continue educating us and our community about all the rapid changes and the things that we're seeing in the space. So thank you so much for being with us today.
Chris, it'd be my pleasure. Thank you so much.
Awesome. And remember, check out Randy's book. I downloaded it just a couple of days ago on Kindle. I'm working my way through it. And obviously, you expound quite a bit on a lot of the principles and topics that we talked about. So definitely check it out if you're so inclined, to our listener community. And thank you to our listeners. If you enjoyed the conversation, please like, share, and subscribe to help us keep growing the show. And if you'd like to learn a little more about Taylor Healthcare and the digital healthcare experience, you can go to taylor.com/digital-healthcare. That's it for today. And until next time, I'm Chris Civitaris, wishing you health and good cheer. Take care.
To learn more about Taylor Healthcare, please visit taylor.com/digital-healthcare. This podcast is for educational purposes only and is provided with the understanding that it does not constitute medical, legal, or financial advice or services. The Digital Healthcare Experience is produced by Naomi Schwimmer. Podcast music by Nicholas Bach.